My name is Peter Mayers and I present the weekly public policy discussion program, The National Interest, on ABC Radio National. The National Interest does a lot of coverage of aged care issues, things like the quality of care, the funding of care, workforce issues and so on. And those are the kinds of things we're going to be discussing today with our three political representatives: the Greens spokesperson for ageing, Rachel Siewert; the Shadow Minister for Ageing, Liberal Senator Concetta Fierravanti-Wells; and the Minister for Ageing, Justine Elliott. Please make them welcome. Today's event has been organised by the Campaign for Care of Older Australians, which is a coalition of industry associations, peak bodies, along with national church, charitable and community-based providers of aged care services. And together they've come up with something called the Grand Plan, and we have a poster for it here. It's a new vision for aged care based on the idea that older Australians should be able to choose the kind of place they want to live in, the location of that place, and they should have access to affordable care when they need it. The patron of the Grand Plan is Catholic priest and radio talk show host Father Bob Maguire.
The first thing that we need to acquire in our evolutionary plan, the Grand Plan, is in fact wisdom. Wisdom. And wisdom teaches us that, in fact, people need people, and people need place, and people need time. And these are all the commodities, of course, that are not all that fashionable these days, isn't it? Time and place. Simple things. Simple things. From South Melbourne, Port Melbourne, where I am, we've been blessed. My 37 years there have taught me something, and that is that communities can, if empowered and given the weapons in the struggle, local communities are the best places possible to win the battle of people being people. So in South Melbourne, Port Melbourne, each of our citizens, in fact, is able to stay on site from the cradle to the grave. You take people out of South Melbourne, Port Melbourne who've been there for years, and you take them on the other side of town, and in fact they lose their memories. Who am I? Where am I? You bring them back and put them back in the same area where they were, and they all of a sudden wake up, snap out of it like that. It's a miracle. But it's a fundamental miracle, and that is that people should be cared for where they feel most comfortable. Thank you, ladies and gentlemen.
Aged care hasn't had a very high profile in the election campaign so far, despite the best efforts of the politicians assembled here. And that's a bit surprising given how much talk we hear about ageing in Australia. In 1970, people aged over 65 made up just 7% of the population. Today, according to the most recent intergeneration report, it's around double that, 14%. And it will come close to doubling again by 2050, by which time almost 1 in 4 Australians will be 65 plus. But there's another statistic, which is that between now and 2050, the number of citizens aged 85 plus will grow fivefold, from 400,000 today to 1.8 million. And real health spending for that age group is predicted to increase 12-fold over the same period. We know many Australians, many of those older Australians, will be suffering from some form of dementia because the risk of dementia increases with age. And increasingly fit as we are, a high proportion of those aged 85 plus will need assistance and care, whether they're living in their own homes or in a specialist residential facility. So how are our three main political parties proposing to prepare for this wrinkly future? We drew names out of a hat to determine the order of speakers, and the winner, I guess we can put it that way, was the Shadow Minister for Ageing, New South Wales Liberal Senator Concetta Fierravanti-Wells. Please make her welcome.
Thank you. And it's a great pleasure to be here to outline the Coalition's Real Action Plan for Older Australians. Can I thank you, Greg, and your colleagues on the Council for Care for Older Australians group for the work that you have done in putting together the Grand Plan. Can I say it's very good to see so many familiar faces here today. I'd like to thank you for the invitation and your time and advice to so many of you over the months, and especially your dedication to ensuring that our senior Australians have the very best care. The very best care, whether in the community or in a residential setting, is the Coalition's goal, and the appropriate balance is clearly articulated in our policy. As Shadow Minister for Ageing, I have travelled across Australia talking with and listening to the broad spectrum of aged care stakeholders, including residential and community care providers, carers, consumers, health professionals, and so many others. Many of you know that I started my community service as a board member of a nursing home in the Illawarra at the age of 23. And in the early 1980s, we saw the need to provide care for older Australian Italians in the Illawarra, and the community teamed up with the Uniting Church, and since then my interest in the sector has continued, especially in relation to ageing issues in our culturally diverse society. Today it is even more personal. My father is 81 and my mother is 80. Aged care touches us all, and whether it's our parents or an elderly relative, as I have travelled around, when people ask me what I do and I am Shadow Minister for Ageing, they want to share their experiences, good and bad. I have read many reviews of ageing, asked questions of the Labor government in Parliament, and put on record the neglect of aged care. We are very pleased about the positive response to our policy. On the other side, Labor has confirmed what we all knew, that aged care was never a priority in the first term. The promise of attention in the second term is supposed to satisfy us all. But it is clear, very clear, a deliberate tactic by Julia Gillard to excise ageing and aged care from the election campaign because older people never vote for us. Labor presents no real plan for aged care in the future, and I have seen firsthand the frustration of the aged care sector with the approach of the Rudd-Gillard government to aged care, the failure to deliver on promises and take hard decisions. How sad that the sector has had to take out begging letters in the national press. The Coalition's Real Action Plan for Ageing will replace the begging with a partnership. The Coalition will provide $935 million over 4 years to provide certainty of care for older Australians and vital support for the aged care sector to prepare for future needs. We will take real action to provide certainty of care through the first ever 4-year aged care provider agreement with the aged care sector. We will establish an aged care bed incentive program to provide $335 million over 4 years to convert up to 3,000 of the allocated bed licences to operational residential aged care beds in the first term. We will provide convalescent care to assist up to 20,000 older people waiting in hospital to return home. We will ensure a high standard of quality care and less red tape, and support the continuing contribution of our senior Australians. Just like the successful pharmacy agreement, and we've just recently, the government has signed the 5th such agreement, the first ever aged care provider agreement will provide certainty and engagement for the aged care sector and set the framework for aged care in Australia for the next 4 years. It will be signed within our first year. The Coalition believes that this will be a game changer for the aged care sector, and the agreement will provide the sector with the high-level interaction with the government that has been absent over the past 3 years. In our policy, we have set out the principles for the aged care provider agreement. Consultation with the aged care sector will commence immediately and will include a range of stakeholders. Under the agreement, dialogue will replace confrontation. The Coalition promises engagement and partnership. The Coalition has also announced that the conditional adjustment payment will be indexed in 2011, pending the outcome of the Productivity Commission Aged Care Inquiry, and this has been welcomed by the sector. The key aim for the Coalition will be to reduce red tape and enable nurses to get back to nursing residence and to provide certainty of aged care for older Australians underpinned by high-quality framework. The Coalition will provide $17 million directly to aged care providers to purchase benchmarking software and training packages. We will also provide $50 million over 4 years for professional aged care programs and services. We will partner with you to identify initiatives to be funded that deliver outcomes for government. The Aged Care Bed Incentive Program will be implemented immediately with funding of $90 million for incentive payments. The Convalescent Care Program will provide funding of $300 million over 4 years to assist up to 20,000 older Australians waiting in hospital to return home to access up to 21 days in a residential aged care facility, which we believe will relieve pressure on public hospitals. To support senior Australians, the Coalition will provide funding to expand the Dementia Program to include other degenerative neurological conditions. We will declare 2012 the Year of Meals on Wheels. We will continue the 30 demonstration sites for day respite care. We will provide grants for pet therapy in aged care facilities. We will provide a companionship program in the community, and we will also promote wellness for seniors. As I have listened to you, you have told me these 3 years have been neglected. Our aged care system needs urgent change to provide a viable and effective future for aged care services for older Australians. Our approach will help to meet care needs now and in the future and ensure that the comfort and safety of older Australians is not compromised. Thank you.